Thank you very much for inviting me to speak today. I'm speaking from England. It's a very early morning here, very dark, cold and wintry. But I'm delighted to be able to talk to you about what the Antonia and Andrea Belcher Trans Fund with Give Out has been doing to help trans communities around the globe. Just to give you a little bit of background about me, I transitioned here in the UK between 2000 and 2003 in my mid to late 40s. I'm now 63. And I was and still am, thankfully and gratefully, married at the time with 3 young children. And I worked in the construction industry here in the UK. So back as the millennium was starting, construction in the UK was, and to a degree still is, a very male business, a male-dominated business. So I feared the fact that I wanted to transition would damage my career as well as damage my family. But I had for 5 years before transitioning led a double life without any of my family or my work colleagues knowing that I was being a nocturnal woman in the evenings and into the small hours of the morning in order to be able to be the other person that I knew I really was. As that story unfolded, I've been a very lucky and successful trans woman, managing to keep all my work colleagues working with me and indeed create a business as a trans woman, with them coming to join me in the city of London, and also through my own transition inspire my clients as well, so that they stayed with me and allowed me to create that successful business. But more importantly, through, I think, patience and care and love on both sides, my family have stuck with me. And I am still married to the wife that I married 39 years ago. And she and I changed our marriage certificate back in 2015 when the UK government allowed same-sex marriage without divorcing, and she and I are happily married together, and my 3 children have grown up from the ages of very early teens through to late teens. At the time when I was telling them what I was going to do, they have been my greatest supporters, and I'm very fortunate in that sense. And my daughter, who is the youngest of my 3 children, has now given me a grandson who I dote on absolutely, and I hope will be equally such a great supporter of what I've done and indeed what I'm doing. So my journey's been successful, but obviously at the time when I was going to change, I feared losing my job, I feared losing my family, but I have not done that, and for that I'm ever grateful. And what I've said to myself is every trans person needs to be able to do this. Every trans person needs to be able to share this. It is a right, it's a human right. It's a moral and ethical right, and there's no reason why in a world like we want to have, all of us together, we shouldn't, as trans people, be able to expect that. So obviously here in the UK, I'm trying to further that aim where I can. I go into businesses and I talk to businesses about my journey, and I talk to them about being trans aware, trans ready, and trans friendly. I talk to them about the metrics of why they should listen to me, what good it will bring for their business. And by that, I'm doing my little bit to try and help educate the businesses, and through the businesses and the allies in those businesses, that they will spread the message and tell all the people they meet. But I've felt, I've been doing that more or less since about 2010, generally off the side of my desk, because I'm still working and I have a day job. But I felt since starting to do that, that's not enough, and we need to be doing it on a more global basis. Trans people around the world who live in communities where we're accepted and allowed to be ourselves, and to demonstrate the power of our individual authenticity. And where we see that it inspires others, we need to trade on that. I felt we need to do it beyond our own shores, and we need to share that elsewhere. I also fear, as I grow older and see my children get older, and I see my grandchild now, fear that, you know, are they going to be able to go around the world and talk about their trans grandmother, their trans mother and their trans grandmother, and talk openly, or are they going to be visiting countries where they're going to have to stay quiet or not talk about it for the fear of the stigma that then attaches to them? And that frightens me and it worries me. So I want to, and I very much wanted to see where we could help in other jurisdictions and other parts of the world. And my focus started to turn on those parts of the world where it's criminalized to be trans. But I equally recognize that you don't necessarily need a criminalization tag or criminalization legislation to still be in a country where trying to be yourself and live a normal life is difficult, and there are too many countries still like that, despite the horrific number of countries where criminalization applies. So Give Out, a charity organization here in the UK, set up particularly to allow people like me to go to them and say, I want to try and raise money, I want to give money, but I want it to be focused, I want it to be specific. For years, I've given to LGBT plus charities, just because I felt I wanted to, and I didn't ask questions, and you know, by many people's measure, it would have been quite a bit of money. But then I started asking those charities afterwards, you know, how much of my donation has actually gone to help trans organizations? And I never really got an answer, but I pestered them. And eventually I would get some answer. And I'd start to realize from the way they were trying to answer me that probably nothing really went to a trans charity. If it did, it was so small that they couldn't even measure it and tell me. And that disappointed me. But it refocused me very much to the point that, you know, I need to do something that's trans specific. So with Give Out, in mid-2018, we set up the Antonia and Andrea Belcher Trans Fund. Andrea is my wife. And I'm seed funding that charity, and have done so for the last 3 years. And given what we've managed to do and then the continuing need for it, I will continue to do so. This charity is the fund has done reasonably well. It was difficult in the first 6 months of 2018, but we still managed to raise just under £30,000. Through 2019, we raised that number to about £60,000. And by the end of this year, we should be on target to have raised hopefully nearly £100,000, if not just over. And the arrangement with Give Out is very much that all the money we're raising, we are granting, and we're now granting it to five jurisdictions, 5 areas around the world, which have been identified by Give Out and CLPR, who've invited me to talk today, is one of the grant partners. The other organisations we're assisting or granting to are based in the Caribbean. There are two organisations there. I'll come on to that. Another one in Tonga Latus, the Tonga Latus Association, which represents the Pacific Asia Islands in that locality. Another one is Equal Rights Association, which is based in the Western Balkans and assists all the countries in that part of Eastern Western Europe that come together to form the Western Balkans. And then there is a recent grant partner that we've been assisting, which is Transparent in Czech Republic. The two organizations in the Caribbean, one is TransWave, based in Jamaica, and the other one is UC Trans, which is a global, a full Caribbean-based organization, which serves a number of islands now, but is aiming to expand to a greater extent. The modus operandi behind the fund is to support trans movement globally, trying to ensure that trans activists and organizations have more of the resources they need to defend their communities and campaign for change. How we are supporting the, excuse me, I'll go on to, right. So from the work that we've been doing and assessing the impact of COVID around the world, obviously I think we all know, before and before the pandemic and regardless of what it's been doing, LGBTQI communities around the world continue to face huge challenges globally, from criminalization and discrimination, and greater to widespread human rights abuses, which are made worse by the impact of climate change. And obviously, I think as everyone will know, is compounded very much so by the fact that our movements are very much underfunded, particularly in the global south and the east. The challenges are already significant, and in any crisis, LGBTQI communities are often disproportionately affected due to these pre-existing vulnerabilities, and the pandemic has only amplified them. As a result, we're seeing trans people around the world being affected in very particular ways. And some of the stories we've heard from our grant partners are issues of trans individuals being forced to quarantine in their homes, where their gender identity or sexuality was being denied or rejected. Obviously, that has led to negative mental health implications for them. And it's further led to trans people who are in these situations often being affected by increased domestic violence, which has been on the rise during the pandemic. We're seeing an exponential need for shelter and food as LGBTQI people lose their jobs and their homes, particularly as trans folk are predominantly in precarious employment, most of them having to do sex work or working within tourism and the creative industries, which have been very, very affected by the pandemic. We also know that trans people were being persecuted through stop and search arrangements with authorities and police forces, and that gender reassignment procedures have been cancelled and deemed non-essential in quite a few cases. We've seen extremist religious leaders scapegoating our communities and blaming them as the cause for the pandemic. And this has been seen from the US, shamefully, I'm afraid, through to Ukraine. In many countries, the police forces are specifically targeting shelters and using the lockdown as a reason to disperse safe spaces, which we're seeing in Uganda. And unfortunately, this list goes on. I suspect you're all aware that that we've seen a total of 350 trans and gender diverse people registered murdered between the 1st of October 2019 and the 30th of September this year, which has represented a 6% increase in reported murders from 2019. If I now outline just how the grant partners under the fund have been responding to their own situations. So TransForm, who's based in Czech Republic, for them in October 2020, the BBC reported that while the Czech Republic was praised for its swift initial response to the coronavirus crisis, 7 months on it began recording 15,000 new cases a day. While these figures have continued to decrease in the past few weeks, restrictions in Czech Republic continue to be imposed. TransForm connects and empowers trans and gender non-conforming people to improve inclusivity in society and advocate for better legislation. Twice a month, they organise facilitated support groups for trans people. This includes organised trips out of urban areas into the countryside, picnics and other get-togethers where trans people can meet and make connections. They also organise workshops for the media on how to use correct language and for companies on how to treat trans people better in the workplace, as well as interacting with politicians and working to improve the legal rights of trans people. In the Central and Eastern bloc of countries, things are very difficult for LGBTQI people, and it's been rapidly changing towards hostility towards transgender people. While the Czech Republic does comparatively quite well in terms of other countries in the region, there is a fear that the Czech Republic will go in the direction of Hungary and Poland, where I'm sure you've seen in the media what's been happening. The pandemic changed trans people's lives drastically. It impacted people's well-being, even though everything moved online, even including the support groups and the workshops for transgender intersex people. Access to healthcare and hormonal therapy was cut and suspended in Czech Republic. They also provided individual counselling to trans people and intersex people, and they've created guidance for trans and intersex people as support during the pandemic. TransForm have noted that during the pandemic, they were appalled to see what was happening in Hungary and in Poland. The atmosphere in the Eastern and Central Bloc has deteriorated politically as transgender people have become an easy target for politicians using the situation around the pandemic. Following Hungary, they've heard from colleagues in Slovakia that there was a parliamentary party that is now being very vocal about protecting only men and women, and that legislation would only be prepared in the binary narrative. They've seen a lot of backlash from these conservative and populist parties. Plus, they've seen extremely homophobic and transphobic rhetoric from Poland, where it's really dangerous, and with the establishment of LGBT-free zones. TransForm, in response, is trying to support their colleagues in these countries. In June, they organised a demonstration in support of LGBTQI communities in Poland, which was attended by many of the main groups. But of course, the pandemic made it more difficult to meet. As the wave of anti-LGBT and anti-trans rhetoric takes firmer hold in the region, TransForm are very aware of how easily this could happen in their own country, particularly during the pandemic, when LGBTQI people are being scapegoated and cut off from services and each other. In Tonga, with the Tonga Latest Association, this is the only organisation focusing on trans, non-binary and gender non-conforming issues and communities, and it has been active for almost 30 years. It is part of the Asia Pacific Transgender Network Foundation and a member of the Commonwealth Equality Network. In February 2020, Tonga closed its borders, even though there's low level of COVID in the country. Give Out have provided an emergency grant through the COVID Fund to Tonga Latest Association to support Jolene. Jolene has been stranded in Australia since February 2020 when she was travelling back from the Solomon Islands and all the borders started to shut down. This has been at a huge financial, physical and psychological cost to Jolene, and we're supporting her in her medical and repatriation costs back to Tonga. as a part of its COVID response, Tonga Latus was able to reach out to its community to provide food, water, COVID-19 prevention information. TLA also has approval from the Ministry of Health and Ministry of Environment to continue work for TLA members as an essential service to all vulnerable groups. During this time, the LGBTQI communities are facing a hard time because the majority are working in hospitality, tourism, and the beauty and fashion industry. COVID-19 has completely impacted the economy of Tonga, even though there have been no cases there. The border was completely shut down, and it's impossible to reach the shores of neighbouring countries. Since COVID hit, many activities have had to be cancelled, and some were postponed until everything is back to normal. Despite this, TLA has been able to remain in the field. They continued their HIV awareness programme for key members, such as MSM, transgender, and sex workers. Jolene shared concerns with how religion is being used against sexual and gender minorities during the COVID-19 pandemic as a patriarchal and colonial tool, which is very dangerous. Regardless of the pandemic or not, there is an increase in countries around the world where regimes are restrictive on the rights of LGBT people, as we know, such as Poland, the USA, Philippines, Brazil, Morocco, Indonesia, and to some extent, even in Australia. Although there is marriage equality, there's not full legal equality, especially for trans men and women, and the biggest opponents to human rights remain the churches. Governments are blatantly justifying and flagrantly defying human rights law and the UN Declaration of Human Rights in limiting LGBTQI human rights through the use of COVID-19 lockdowns. In the Western Balkans, with ERA, regionally, the pandemic has seen governments quarantining human rights in the pandemic, but civil society groups and activists are now pushing back, protesting about backsliding and filling the void. Human rights in the Balkans during COVID-19 are being threatened to human rights and freedoms restricted amid the current health crisis. At times, government restrictions have been justified, such as limiting people's movement to hinder the spread of the disease. But at other times, restrictions have been unnecessarily excessive and without a legal basis, and have had a damaging impact on a range of fundamental rights. The pandemic has affected human rights in two ways there. One is direct, with the introduction of extraordinary measures that go beyond legal norms and unjustifiably restrict freedom of movement and expression. The other, more indirect effect of the pandemic has been to expose pre-existing patterns of discrimination that especially impact vulnerable groups, such as minorities and the LGBT+ communities, refugees, migrants, and older people. The pandemic has made LGBTQI people go back to the closet. In the Western Balkans and Turkey, where Give Out has partnered with a trans, non-binary and intersex caucus of the LGBTI Equal Rights Association, we've been hosting online community building events to share their knowledge and plan for the future with their trans communities.
Antonia, please excuse my intervention, but you have about 5 more minutes.
Okay.
If that is right.
That's
and
fine.
I think there will be scope for us to come back to some of these perspectives and stories of interventions that you share.
Okay.
Thank you.
Thank you. I won't go on with the detail that we're doing in TransWave then, and we can talk about that later if you want to when you see trans. But I think obviously from what I said, I've given you a reasonable view of what we're trying to do, where the need is, how the response is being given. What I wanted to say was that the importance behind a lot of this is solidarity, isn't it? It's the simple aspects of you know, well-meaning platitudes are good, but they don't get things done. We as trans people need to help our trans cousins wherever they are, and we need to do it on a global basis. We need to prioritize our own actions and get them in train, and I hope that the Antonia and Belcher Trans Fund is doing that in a small way. The questions I ask myself are very much, how do we as a community get more global? You know, we need to increase our solidarity worldwide. We need to educate worldwide. I'm a great believer in a UK saying, from little acorns, great oaks grow. The history of hierarchy shows us that solidarity is so important. Being advocates for one another, wherever we are, whatever our own circumstances, is so crucial, especially in the world today, facing the challenges we all have to endure. But that advocacy needs to be global. Trans people in countries like mine need to be ready to support our trans cousins. One of the dimensions that has inspired me, and I went to Albania last year, I was hoping to go to the Caribbean area this year to meet with TransWave, and I was very much hoping to be with you today in Bangalore in person, because I want to meet people. I want to see how we can help. I want to learn more. The big questions to ask: what do we learn from COVID, and what authorities have done in response to it? You know, will those things become norms? Could those things be done again for whatever reason, even a looser reason than the pandemic? But what's inspired me is that the people I've met, the people who've come to the UK to talk to me about what they're doing, is that they find it inspiring that a trans person is helping and is trying to raise money. I've had comments like, it's just great to know that someone is helping and someone cares, someone from our own community. I will just finish on a note that I was at a give out celebration last week, and Vikram from CLPR joined that, and he summed it up perfectly for me when he said, it takes a community to survive. And I think that's the important point. So I will stop there, because I could talk forever, and I'm a great one for doing that. So